The UCLH Cancer Collaborative is a collection of NHS organisations working with patients that covers the whole of North and East London, 3.6 million people. And the purpose is to bring NHS organisations together to improve cancer services. We know from research that if you diagnose people early, they've got a much better chance of success in their treatment. So that might be new screening tests, that might be working with GPs so that people get the right referrals when they need to. And the other focus is living with and beyond cancer better. It's a great success that people are living longer, the treatment's got better, but coping with the long-term consequences can be really difficult for patients. There's no better way of designing a patient-centred service, encouraging patients to use services, than having patients who are able to represent the community, who can speak from experience, involved in what we do.
I'm Carol. I live in East London, in Hackney. I was diagnosed with secondary breast cancer. I decided to become involved because living with a treatable, not curable cancer, I had the opportunity to make a lot of observations of my experience of care, both in the community and in the hospital. And I really wanted to share my lived experience and come together with others to build that collective voice and really escalate the pace of change.
Well, I was diagnosed with prostate cancer about maybe a decade ago. I was actually very grateful to the hospital. And I thought, I really would like to give something back. Care works better when the patient and the consultant and the professionals work as a team, when they can talk to each other frankly and when they can listen to what each other says. You've got to understand that patients often don't take on board what you're saying the first time. Patients may not be able to ask the questions which they wish they had asked later. So if you don't know what's going on in the patient's head, you really can't treat them effectively. And it helps to get the perspective of a patient who's been through what other patients will be going through. It helps to get the perspective of a carer who's been through what other carers will be going through.
A huge part of what clinicians have to do is give information to patients. It's really important that we've tested information and co-designed information.
Whether through leaflets, seminars, training, whether online or broadcast, they need to get that patient perspective. If a leaflet is too difficult, people just throw it away. If a survey is too intimidating, people won't do it. That's one area in which I think I have made a difference.
In every project, in every service, in every meeting, I want patients to be not only present, but also to be at the heart of what we do. Anyone can help us. We don't need professional or medical expertise. We just need people with an open mind and a willingness to get stuck in. They could become a member of a strategic board, helping us make decisions. They could share their own experiences with a group of clinicians as part of their professional development. They could get involved in workshops, helping us to design new services. There's loads of different options.